welcome. So I thought I would pop on briefly and talk about some of the feedback that I got from my friend after the last iris reading that I did. And I got some super exciting feedback and I wanted to share that with you guys, and then I'm going to move on to her botanical blueprint. So today I just want to touch on a couple of highlights that I think are significant, not just to iridology, but also just the overall field of natural healing. So, and then, like I said, we'll go on and we'll talk about the specific plants that are going to be in her formula and that will relate to certain aspects and features that we saw in her eyes. So I think if you did see that video, you'll probably remember, and probably yourself, if you're into iridology, were wondering how there could be a break in the skin ring. I myself have never seen anything like that, at least to that degree. Sometimes it gets a little fuzzy, sometimes there are little nuances within the skin ring, but a break like that, I was certainly doing a double take. So I asked her to watch the video and give me some feedback, and of course she did, and she loved it, and there was a lot that was seen in the iris that was confirmed by my friend in terms of her health and her health history and her family genetics and all that. But there were a few things that especially I found of interest, and that is, so we saw in the skin ring at the throat very marked notches in the skin ring at the throat. And then we also saw a low thyroid or a likely hypothyroid. And we also saw some tension in the neck, so this whole area. And she did come back and she let me know that when she was 7, and 7 being a very significant age, not just in the human development, but also in the physical development of the child, also in the spiritual development of the being. And you will see a lot of things that show up in the iris around that age. And this in particular, this was actually an event. And she actually, at this age, fell into a rose bush. And it's interesting because I had rose on her list of plants. It was just something that came to me intuitively. And she sliced her throat open. So in iridology, you will see not so much markings that appear like if you have a surgery or something else that injures the body in some way. If you're under anesthesia, you're not really going to see it. That's what I've learned, that's what I've been taught, that's what I've seen. And that is because of the nervous system isn't recording that information, at least on that level, and the eyes are therefore not picking it up. But when you have an event that happens, a traumatic event that happens, and by trauma, I mean, certainly physically slicing your throat open in a rose bush, but also the emotional impact of that at the age of 7. So I thought that was super interesting, and I thought that was just another testament of how uncanny the accuracy of iridology can be. So I wanted to share that with you guys. And then also along those lines, we did see, and this is a thing that you would maybe want to look out for, because in terms of healing the entire being, you're going to be looking at all of the aspects. And so it's not surprising that we also saw the thyroid coming up. And the thyroid is related to Vishuddha Chakra, and that is the element of air, and it is related to speaking. And this is true of my friend and a lot of people that I know. When you have thyroid imbalance or challenges, a lot of times you had some sort of influence. A lot of times it's a parent that has sort of stifled your voice. And that was the case with my friend. And so I thought that was also noteworthy. And sometimes I have noticed, I didn't see it directly with her, but you do, so you want to check the thyroid. When you see anything along the lines of speaking and thyroid, especially in this case when there was actual injury to the throat. And sometimes I have seen the acquired mental speech brain zone also affected. And I didn't notice this. I haven't looked at her eyes again and, gone back and seen how the feedback may relate to what I saw and what I'm seeing now. But I do remember that her pituitary was of significance. So, and the acquired mental brain zone is right above the pituitary gland. So very well could be affected. Not anything that I noticed. So, but I have seen that in other cases where I've seen the acquired mental brain zone and the thyroid and had feedback about speaking. And so this would be seen sort of as a weakness. But we're seeing also not just in iridology, there are some iridologists that would consider it not actually weakness, more of a focus. And I see this in terms of healing, and I see this in terms of people's life path and what they're choosing to focus on. So a lot of times when you see something that looks like a weakness, especially like a large lacuna or a pigmentation spot, you think that that is going to hamper that person's ability to speak. And in fact, sometimes it does. But what it also does is it highlights that the capacity of speech and speaking and communicating for that person. So in fact, a lot of times that's a focus for that person, and they end up being someone who is involved at, a lot of times not to their liking because it's something that they've had to work on. But a lot of times these people are excellent communicators, and the focus that they've put into this particular area shines through in their life and in their path. So, yeah, that was the throat. I thought that I was floored, completely floored. I see a lot in iridology, but I thought that was really fascinating, and I wanted to mention that. And we will come up with some foods and some herbs that will help to pick that thyroid gland up. And so in terms of the thyroid, I think that I should mention, I did talk to her about taking the glandular. And for me, this is absolutely my personal perspective, and mostly it's going to come down to, or 100% it will come down to the person that you're working with and for yourself, how you feel about taking glandular. And for me personally, I would say, so my friend did say that she did have some symptoms of low thyroid. And we have with that like a low, lethargic type of symptoms when you're looking at a low thyroid. And often you will have along with that a low heart rate, and she does, and low blood pressure at times, nothing extreme. And you'll also have depression sometimes when it's pretty low. And so we talked about that, and that has been something that she has experienced, but not on the level where, if you have depression and it's something that's really affecting your life. I mean, we all have cycles. It's hard to say sometimes, because life can be tragic and we can go into low cycles. And sometimes it's even hard to really understand that we're in one of those cycles. So, that's to be taken on an individual basis. But for my friend in particular, yes, some times of some depression. And if it were to the point where it was really something that she was worried about and it was affecting her overall life, and she also had other symptoms of low thyroid that were also affecting her life in a detrimental way, then I would say absolutely get on thyroid glandular. But in this case, I think she's going to consider it, and we'll see if we can pick the thyroid up with some herbs and then maybe go from there. So I think that's all I wanted to say about the throat and the thyroid. And then there was also an interesting thing that she told me. And so if you recall, if you watched the video, and if you haven't, I welcome you to do so. There was a lot of liver coming up in that iris reading. Not super specifically, if I recall correctly, the liver itself. I remember seeing something going on in the liver, and it may have been more the gallbladder, but just the fact that she had so many dark psora or pigmentation. And so that definitely was confirmed by her, and there definitely are some symptoms that she's experienced related to liver weakness. But one that I thought was really interesting was that she was born jaundiced, slightly jaundiced, right? And that connection between the liver and also between the liver and the pigmentation or the psora, I certainly do find fascinating. And I wanted to mention that I've seen this before, and even in my own daughter's eyes, she was also born jaundiced. So, you know, a slight yellow tint to the skin, if you don't know what jaundice is, indicating a weakness in the liver. And with my daughter, she was born a little bit late. So I think sometimes that can contribute to jaundice. But point is, my daughter also has a psora spot or pigmentation. It's not super dark, but it's fairly light actually, but it's pretty significant right on her liver. So you might be checking that when you're looking at your eyes or at other people's eyes, or just, you know, having that to be something that you can ponder on when you're thinking about the connection between the liver and the pigmentation. Because I also came across something that Rudolf Steiner said about, he said something that, so I have been sort of questioning, you know, you question as an iridologist what the psora are. Are they literal drug deposits, or are they, as the German iridologists say, more a result of certain processes in the body? And especially the liver being the alchemical organ, and especially related to chemicals that come into the body and toxins. And the liver also showing up as darker psora or pigmentation. But something that Rudolf Steiner said about, he said substances are a result of multiple processes. And I thought, so a substance in and of itself, which is something that is very much related to the psora or the pigmentation, is a result of internal processes. And that really struck me, because that's sort of something that we ponder in iridology. And I think that that is more the answer, certainly, than an actual drug somehow showing up in the iris. It's more so that the drug, when taken internally, triggers a response, and quite often from the liver. And if the liver is weak, that response is going to be more profound. And that response somehow within the alchemy of the body reflects the same color, the same ray, the same vibration of the original substance taken. So, yeah, that is something I will continue to ponder. And if anybody has any feedback on that related to their own eyes or their own, your own thoughts on how psora are appearing in the iris, I love to get feedback, so feel free. And then I think the last thing I want to talk about before I go into her botanicals is birth control. And again, somewhat related to the psora and the ability of the liver to process toxins and the sometimes detrimental effects. It depends. It completely depends on your constitution, and depends on how old you are when you're taking the birth control, how many years you've taken the birth control. But it sort of goes without saying that, or maybe not, I'm not sure, it seems fairly obvious, and it's confusing because birth control is so widely used and prescribed. It does, when you suppress a major function of the body, especially related to hormones, and especially in this case the reproductive system, you will have effects. And again, you might take birth control or other medication briefly, and your body will be able to process and work through those toxins. But in my friend's case, and I thought this was fascinating because I've seen this with a few other irises, and I've always kind of wondered, but a lot of times you do readings and you get feedback and everything's awesome, but you don't get the specific feedback. So that is just one of the many reasons that I was excited to do this reading for my friend. But so she gave me some feedback, and that was that she was on birth control for many years, not 20, but I believe, and starting early, so starting at age 17-ish, so late teens, well into her 20s. And I've seen this before in the iris, and again, I'm interested to know if anyone has experienced this. I've seen literal psora or pigmentation on the uterus, on the ovaries, on the breasts. So in the entire female reproductive system, birth control shows up, again, as a result of the processes that are going on in the body. You can see the effects on the literal organs in the iris. And usually it's more the ovaries or the uterus, and then secondary would be the breasts. And in her case, we did see a lot of signs in the entire female reproductive system. And that was actually something that she had expressed some concern about, more on an intuitive level. So I'm going to include a few herbs, and maybe even offer her a complete female reproductive formula. So, but certainly will include some herbs for the reproductive system in her overall detox tea that I'm going to make up for her. But I thought that was super fascinating, and like I said, I've seen it before, so I wanted to mention that. And I think that might be it that I got for, let me see here. There was a lot, and I'll talk about some more of it in the part where I'm gonna do that probably right, very soon after this video. I might clip it to this video, so we'll see. One more thing I thought was interesting. So she's been to, had a lot of experiences with natural healers. Oh, before that. So definitely we saw some signs of chronic inflammation and possibly chronic pain, and that definitely was the case. So I wanted to say that. But in terms of when you see an acupuncturist, which is in this case what she was telling me about, all of the time she said she's seen an acupuncturist, the spleen has come up. So that would be more the spleen meridian. I haven't super studied the difference between the actual spleen organ and the spleen meridian in Chinese medicine, but needless to say, there's got to be a connection, right? So that was interesting to me. And then also some confirmation on the lymphatic congestion we were seeing. And also, she has mentioned to me before that her kidneys come up sometimes when she has been to a Chinese medical practitioner. So it's always really fascinating when you have all these different angles that lead back to the truth of what's going on in someone's body. So yeah, I thought that was also very interesting. I wanted to share that with you guys, and I'm going to move on now to the next video, and we'll do a complete botanical matching and come up with at least one formula, probably a couple for her. So stay tuned, and thanks for watching. Okay, bye.